Hello, my name is Jessica Cataldi. I'm a pediatric infectious diseases physician at the University of Colorado, and I'm excited to tell you about our study titled Use of Standing Orders for Vaccination Among Pediatricians. In this nationally representative survey, we found that 59% of pediatricians use standing orders for immunizations. Those pediatricians who did not use standing orders often had concerns that standing orders remove physicians from conversations and decisions about vaccination. Let's take a closer look. Standing orders are protocols that allow non-physician personnel, including nurses and medical assistants, to vaccinate patients without the direct involvement of a physician at the time of vaccination. The use of standing orders for vaccination is recommended by the Centers for Disease Control and Prevention, the Advisory Committee on Immunization Practices, the Community Preventive Services Task Force, the National Vaccine Advisory Committee, and the American Academy of Pediatrics. These recommendations are based on prior studies showing standing orders to be an effective and cost-effective way to increase vaccination rates. Studies examining adult immunization practices have identified factors associated with use of standing orders. Structural factors such as payment issues and clinic leadership may influence use of standing orders. Barriers to use of standing orders for adult immunizations include patient concerns about whether vaccination is recommended by their doctor and challenges determining indications for vaccination. Much less is known about the use of standing orders in the pediatric context. In this study, we sought to assess pediatricians' current use of standing orders for vaccination, barriers to use of standing orders, and factors associated with use of standing orders for vaccination. We conducted an internet and mail survey in 2017 among pediatricians in a sentinel network of members of the American Academy of Pediatrics who spent more than half of their time practicing primary care. After defining standing orders in the survey, we asked respondents to indicate whether they used standing orders for all routinely recommended vaccines, for some vaccines, or not at all. We also asked respondents to rate the degree to which different factors were barriers to the use of standing orders. We conducted factor analysis and barriers items grouped into two factors: items related to physician responsibility for vaccination and items reflecting concerns about office processes about standing orders for vaccination. Multivariable analysis was conducted to predict use of standing orders among survey respondents. We received 372 surveys for a response rate of 79%. 59% of pediatricians use standing orders, including 36% who use standing orders for all routinely recommended vaccines and 23% who use them for some vaccines. Overall, pediatricians who did not use standing orders were more likely to report several items as major barriers or somewhat of a barrier to use of standing orders. The most commonly reported barriers among all respondents were items that grouped onto a factor called physician responsibility. This included a concern that patients may mistakenly receive the wrong vaccine if a pediatrician does not assess their vaccine eligibility, and a belief that it is important for the pediatrician to be the person who recommends a vaccine to their patients. In bivariate analysis, several physician and practice characteristics, as well as both barriers factors, were associated with use of standing orders. In the multivariable model, only physician responsibility barriers remained associated. Pediatricians who reported more significant barriers related to physician responsibility for vaccination were less likely to use standing orders. Standing orders are an evidence-based strategy to increase vaccine uptake, yet more than 40% of pediatricians surveyed do not use standing orders for vaccination. Future work to promote use of standing orders must address physician concerns related to their personal role and responsibility for patient vaccination, as well as organizational factors. To learn more, please read our manuscript in Pediatrics.